This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello, wonderful audience. This is your host, Dr. Famuyiwa, with another episode of Fertile Talks. So today I am going to do something that's a little near and dear to my heart. We're going to be talking about fertility and the multicultural patient. And we're going to talk about navigating the barriers and access to care for our multicultural patients. So, fertility challenges are really universal. They know no borders. It affects millions of people worldwide. And not everybody knows how to seek help. In fact, fertility and subfecundity affects about 15% of the world's population. And yet many face unique barriers that go beyond the medical diagnosis. So in this episode, we're going to explore how cultural, social, and linguistic factors can actually shape the way individuals and couples navigate infertility, with a focus on what we can do to help create a more empathic fertility care for our multicultural patients. So, what is the global impact of fertility? Infertility affects probably about 48.5 million people, couples worldwide, maybe more. I think recently the World Health Organization states that it affects 1 in 6 individuals. It used to be 1 in 8. So access to treatment and even acknowledgement of the fact that issues vary across different cultures can be difficult. So infertility in many societies is actually considered to be taboo. You just don't talk about it. Even mentioning the word can bring significant psychological distress. So, this taboo often prevents individuals and couples from seeking treatment early. And early treatment may be crucial for better fertility outcomes. There is a lot of psychological duress from cultural norms. In several cultures, for instance, admitting that you need help for fertility issues can be seen as a personal failure. And the social pressure to conceive is so immense, especially in communities where children are often viewed as essential to family and personal identity. For example, in Vietnam, children are often seen as the ultimate source of personal happiness and marital satisfaction. So, a wife's ability to integrate into her husband's family frequently hinges on her ability to bear children. Similarly, in many South African cultures, marriage is not just a union between two individuals, but also between two clans. So, children therefore become the symbol of lineage continuity, a concept that is also deeply ingrained in, say, Nigerian, Ghanaian, Middle Eastern, and Chinese cultures, failing to produce a child is often seen as failing, period. It's seen as failing the entire family, not just one spouse. I'll give you a couple of examples. Several years ago, I treated a patient who came from a country in East Africa, and it was actually her husband's niece that brought her to my care because she was not happy with the way her family were treating this young lady. It turned out she was married at age 14 or 15 to her husband, who was much older than her. And she came to me when she was 30 years old, but had not been able to conceive a child. Now, her husband, needless to say, had attempted to conceive, but was unable to have a child with other women as well. So when they came to see me, she could not speak English. She was very scared. She was in a different country. And he basically callously told her, if you don't, here's the sperm, freeze it, call me when you're done, don't call me before then. This is a woman that was stigmatized by her husband's family, and her mother in law used to call her names, derogatory names. Upon workup, I actually found out she was actually very, very fertile, but we had difficulty with his sperm. He was the issue. And unfortunately, she was bearing the brunt of this psychological pain they were heaping upon her. So, it can be very, very difficult, presenting a huge emotional burden, making it difficult for these women to seek help. Another thing is the stigma, especially in cases where the societal roles are extremely rigid. The consequences of cultural stigma. In many communities with rigid social roles, the stigma associated with infertility is particularly severe for women. In these cultures, motherhood is closely tied to a woman's identity and her place within her marital family. If a woman is unable to conceive, the repercussions can be devastating. For example, in parts of South Asia, Middle East, women who cannot conceive are sometimes ostracized and labeled as barren. In extreme cases, they may be expelled from their marital homes or subjected to physical and psychological abuse, like the lady I mentioned previously, and these women may find themselves replaced by a second wife or relegated to a status of a servant within her husband's household. In some African and Middle Eastern cultures, where children are seen as a guarantee of lineage, a woman's inability to conceive can lead to severe social consequences, including divorce and isolation. The psychological toll of this type of rejection can be profound, making it even more difficult for women to seek medical help. So, interestingly, this I don't think is related to educational background, right? There's an intersection of education and cultural norms. These social cultural pressures persist regardless of educational levels. Even highly educated individuals may internalize the stigma surrounding infertility. Education alone does not always break cultural taboos, as family and societal expectations remain extremely powerful influences. I'll give you an example. I, many years ago as well, was privileged to take care of a couple. The husband was an esteemed professor of surgery in a major African medical school, and his wife was the department chair in one of the scientific divisions. Her unfortunate what she did wrong was she had conceived 5 girls, and they made it exquisitely clear to her that if she did not conceive a boy, she would be expelled from the family. So when they came to see me, I worked them up. There was no. It was a case of unexplained infertility. She went and took. This was back in the days of back in the days of Clomid, right? She took Clomid on her own and took a little bit of an overdose of Clomid, and she actually conceived and had twins, and that was what saved her from the psychological abuse, if you will. So, um, another thing that we can discuss is the barriers to accessing fertility care, right? Cultural reticence and language barriers. One of the most significant barriers to fertility care is cultural reticence. Many multicultural patients hesitate to seek care, not only because of stigma, but because they feel their healthcare providers might not fully understand or empathize with their background. There are language barriers. For non native speakers, the language barrier can exacerbate feelings of isolation and frustration. Even in fertility clinics, where understanding of medical terms is crucial, patients may struggle to communicate their needs, leading to misunderstandings or feelings of being overlooked. Cultural differences and empathy in care. A critical barrier to seeking care is the perceived lack of empathy from the healthcare providers who may not share the same cultural background. This may create a disconnect, making patients feel as though their concerns are not being heard or understood. Empathy in healthcare does goes beyond understanding medical facts. It involves being sensitive to the patient's cultural, emotional, and psychological context. For example, I had a Chinese couple seeking fertility treatment who told me how uncomfortable they felt during their initial consultation at another clinic. The doctors dismissed their concerns about how traditional family values would influence their decision making. When they came to our clinic, we took the time to listen and to include these cultural considerations into their treatment plan, allowing them to feel more supported. I had a recent case where a patient of mine who could not speak English very well. So when they were explaining her treatment option in her previous clinic to her, she did not understand what was being asked of her. So she consented to a surgical procedure that she later on regretted. She had laparoscopic drilling of her ovarian tissue, and she stated that that was not clearly what she wanted. She did not understand the consent forms that were placed in front of her, and she feels a little bit embittered because that's not the treatment that she wanted. So, how can providers address the need for multicultural patients? Listening and sensitivity to provide comprehensive and compassionate care to multicultural patients. Fertility specialists need to listen carefully and be sensitive to the unique backgrounds and cultural pressures their patients face. Taking time to understand the emotional and social context can make a significant difference in treatment outcomes. So, overcoming barriers to empathy. This cultural competency is key to breaking down these barriers. Providers should educate themselves about the cultural and social factors that affect their patients' perceptions of infertility and be willing to adapt their communication style to meet patients where they are, to create an inclusive environment. So we need to make sure that patients understand what they're being told, make sure that we respect the choices that they make, what they perceive as what they want from themselves. Um, Understanding some of the barriers that patients face is also important. I remember many years ago, I had a patient whose husband brought her to my office. She did not speak English and basically said, well, I want her to have, I think the word he used was Sunni, which when I looked it up was a form of genital mutilation for women that's done in certain Indian cultures. Um, when they're recently married. And I was really dumbfounded. I had to sit him down and said, we will not be doing this, and this is why we're not going to be doing this. So we still have some of that culture, that stigma, where patients bring to a new country with them, and we have to sit down with them and try to get an understanding on their part, and try to protect. Our role is to protect our patients, especially the women patients. So, so In conclusion, I want to say that fertility is a universal issue, and it's clear that cultural, social, and linguistic factors play a huge role in how individuals and couples experience infertility. So, as providers, our responsibility is to offer care that is not only medically sound, but also culturally sensitive and empathic. By listening carefully and tailoring our approach to meet the unique needs of multicultural patients, we can help to break down the barriers to fertility treatment and hopefully help break. We need to start helping to break down some of the stigma that some of our patients face, supporting them, so supporting all our patients in their journey to parenthood. So thank you once more for joining me today on Fertile Talks. And if someone that you know is facing fertility challenges, please don't hesitate to reach out for support. We are here for you. Thank you. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.